Hello and welcome. Today we're diving deep into a critical topic concerning cardiovascular health: hypertensive heart disease. This condition, often silent in its early stages, poses a significant threat to millions worldwide. Join us as we explore its causes, mechanisms, symptoms, diagnosis, treatment, and prevention, empowering you with the knowledge to protect your heart. Hypertensive heart disease, as the name suggests, arises from prolonged high blood pressure, also known as hypertension. Think of your arteries as pipes. When the pressure inside those pipes is consistently too high, it puts a strain on the heart, forcing it to work harder than it should. Factors contributing to hypertension include genetics, lifestyle choices like a diet high in sodium and low in potassium, lack of physical activity, excessive alcohol consumption, and smoking. Certain underlying conditions, such as kidney disease and sleep apnea, can also contribute to the development of high blood pressure and, consequently, hypertensive heart disease. Now, let's delve into the inner workings of how hypertension damages the heart. Chronically elevated blood pressure initiates a cascade of damaging effects. First, the heart muscle, particularly the left ventricle responsible for pumping blood to the entire body, thickens. This is called left ventricular hypertrophy. While initially a compensatory mechanism to handle the increased workload, this thickening makes the heart stiffer and less efficient at filling with blood. Second, the coronary arteries, which supply blood to the heart muscle itself, can become narrowed and damaged due to high pressure, leading to decreased blood flow. This can cause angina or even a heart attack. Furthermore, the atria, the upper chambers of the heart, can also enlarge. Over time, all of these changes contribute to heart failure, a condition where the heart is unable to pump enough blood to meet the body's needs. Hypertensive heart disease is a prevalent condition, affecting a substantial portion of the global population. Its incidence closely mirrors the prevalence of hypertension, making it a significant public health concern. Statistics vary depending on age, ethnicity, and geographic location, but generally, the risk increases with age and is higher in individuals with poorly controlled hypertension. Undiagnosed or untreated hypertension is a major contributor to the development of this disease. Factors like socioeconomic status and access to healthcare also play a role in determining its distribution and impact. In the early stages, hypertensive heart disease may present with no noticeable symptoms. This is why it's often called a silent killer. As the condition progresses, symptoms may gradually appear. These can include shortness of breath, especially during exertion or when lying down, chest pain or discomfort, known as angina, fatigue and weakness, swelling in the ankles, feet, and legs, a condition called edema, irregular heartbeat or palpitations, and dizziness or lightheadedness. It's crucial to remember that these symptoms can also be associated with other heart conditions, so proper evaluation by a healthcare professional is essential. Diagnosing hypertensive heart disease involves a comprehensive assessment. The cornerstone is blood pressure measurement, revealing consistently elevated readings. An electrocardiogram, or ECG, can detect abnormalities in heart rhythm and signs of left ventricular hypertrophy. An echocardiogram, which uses sound waves to create an image of the heart, can assess the size and function of the heart chambers, identify any thickening of the heart muscle, and evaluate the valves. A stress test may be performed to assess how the heart functions under physical stress. In some cases, a cardiac MRI or cardiac catheterization might be necessary to obtain more detailed information about the heart and coronary arteries. While there aren't distinct types of hypertensive heart disease in the same way as some other conditions, it's more accurate to describe the different stages or manifestations of the disease. These can range from early left ventricular hypertrophy with preserved heart function to more advanced stages involving heart failure with reduced ejection fraction, meaning the heart isn't pumping blood effectively. The severity of the disease is typically classified based on the degree of heart damage and the presence and severity of associated symptoms. The primary goal of treatment and management is to control high blood pressure and prevent further damage to the heart. Lifestyle modifications are crucial, including adopting a healthy diet low in sodium and saturated fats, engaging in regular physical activity, maintaining a healthy weight, limiting alcohol consumption, and quitting smoking. Medications such as diuretics, ACE inhibitors, ARBs, beta blockers, and calcium channel blockers are often prescribed to lower blood pressure and manage symptoms. In some cases, procedures like angioplasty or bypass surgery may be necessary to improve blood flow to the heart if coronary artery disease is present. Regular follow-up appointments with a healthcare provider are essential for monitoring blood pressure, adjusting medications as needed, and addressing any new or worsening symptoms. Preventing hypertensive heart disease starts with preventing hypertension in the first place. This involves adopting a healthy lifestyle from an early age. This includes regular blood pressure monitoring, especially for those with a family history of hypertension or heart disease. Dietary changes, regular exercise, maintaining a healthy weight, limiting alcohol and sodium intake, avoiding tobacco use, and managing stress are all essential preventive measures. Early detection and management of risk factors, such as diabetes and high cholesterol, are also crucial for preventing the development of hypertension and subsequent heart disease. The prognosis of hypertensive heart disease varies depending on the severity of the condition, the presence of other health problems, and the effectiveness of treatment. Early diagnosis and aggressive management can significantly improve outcomes and slow the progression of the disease. Recent research is focused on developing new medications and therapies to better control blood pressure, reduce heart muscle thickening, and prevent heart failure. Studies are also exploring the role of genetics and biomarkers in identifying individuals at higher risk and tailoring treatment strategies accordingly. Emerging therapies, such as targeted drug delivery and regenerative medicine, hold promise for future advancements in the treatment of hypertensive heart disease. Thank you for joining us in this discussion.